Hello and welcome back to my channel. This is Dr. Brenda Mondragon. I am a chiropractor. Yes, that's right, a licensed chiropractor. Today's topic will be on headaches, the different types of headaches, at least the ones that I most commonly see in my practice and that patients present with. There are about 7 different main categories of headaches that have different origins, different symptoms, different presentations. I'm going to be going over the different ones today to help you identify what type of headache you're suffering from. Chiropractic can help with headaches, but it isn't always the end-all be-all for headaches, so hopefully this video will enlighten my viewers on when to seek chiropractic care, when chiropractic can help with a headache, and when they maybe need to go seek out more emergent care for their headache. Number 1, the common migraine. We have 2 different types of migraines, classic and common. The classic type of migraine begins with an aura or scintillating lights, followed 30 minutes to an hour with a debilitating headache, which then follows nausea, sensitivity to light, pounding, throbbing headache. It really helps to work with the patient identifying the trigger for the migraine. If the trigger can be avoided, oftentimes the migraine can be avoided. Common triggers are different types of foods that you eat, chocolate, cheeses, the glare off of a car or off of glass that hits the back of the eye, that can trigger a headache. Dehydration, stress is often a common trigger. Bright lights, loud sounds, anything that, so to speak, overwhelms the nervous system and overwhelms the brain. Those are your common triggers to migraines. While chiropractic care can help with the migraine, it's usually better to head them off before they get that bad. Migraines can last anywhere from a couple hours to a couple days. Number 2, tension headache. Head feels like it's stuck in a vise. It usually will feel like a band pressing around the head. Tension headache. This one can easily be alleviated by decreasing stress, decreasing whatever is causing this tension. Oftentimes people they have their shoulders up by their ears and they don't even realize it. Simply going for a walk, getting some fresh air, doing another activity than the one that was causing the stress usually helps to alleviate the tension type headache. Number 3 type of headache, cervicogenic headache. Cervicogenic, originating from the neck. We call this the cervical spine, which is the 7 vertebrae in the neck. So it's a headache originating from the neck. Number 1 most common reason why it would be originating from the neck, it is looking down. When you look down, the head weighs more compared to the paraspinal muscles that are holding the head up. So instead of a 15-pound head, your neck muscles are now working to hold up an 80-pound head. And you're going to get a headache, small wonder. Number 4, the cluster headache. It is an intense pain in the eye lasting from 15 minutes to a couple hours. It feels like an ice pick in the eye. The eye will start to water, turn red, tear. It's a really, really severe ice pick type pain in the eye. Cluster headache. At the end of the day, headaches aren't really well understood as what their causes are from, especially the ones that I've mentioned, the migraine, the cervicogenic, the cluster. Those types of headaches, we think it is some sort of neurological disconnection going on in the brain. There's theories with the migraines that the arteries go through a period of constriction, and therefore you get the aura, and then they go through a period of dilation, which is the throbbing headache. We do kind of have some sort of idea, but it really hasn't been identified what exactly is causing the pain, except that the pain is felt here. Number 5, a sinus headache. This is pressure in the face caused by the sinus cavities. There's 2 here and 2 here. the two big ones. It'll feel like a lot of pressure. You'll usually be recovering from a cold, or you have some sort of sinus infection, difficulty breathing. Leaning over like this will increase the pain, and kind of tilting yourself back, you'll notice a decrease in the pain or an alleviation of the pain. These headaches go on for as long as sinus pressure is felt. I have a lot of good videos on sinus congestion work that really does help with headaches. I'm going to go over some of the more serious types of headaches, ones that you should be more concerned about. Just remember, guys, I haven't gone over all of the triggers of a headache. There are many, many different triggers. There's a whole plethora that you can look up. I haven't gone over the TMJ, vision problems. Really isolating the trigger is what's going to help you understand the cause of your migraines and thus preventing them from occurring. There's high blood pressure types of headaches, and those are usually occur first thing in the morning when you wake up. So a good thing to do when you have a headache and you notice it coming on in the morning is to check your blood pressure. If you're noticing that these two things coincide, it's good to go talk with your doctor and discuss your health options for mitigating the high blood pressure. Hypertension is usually felt in the back of the head and it radiates forward. That's usually caused by increased pressure in the interthecal space of the cervical spine of the central nervous system, and it just kind of goes forward towards the front. Symptoms are worse in the morning. The seventh one, this is the most serious headache, one which you really do need to seek emergent medical care, and that would be a brain aneurysm. A brain aneurysm happens when a blood vessel in the brain bursts. It's described as the worst headache of your life, and this is really a 911 emergency where you would have to go to the hospital. It can give you off many different symptoms before it actually bursts. Odd symptoms, sometimes people smell things, funny things, they taste funny things. Some people even just pass out from the aneurysm. Again, the worst headache of your life that you've ever experienced. Anybody saying that, red flags are going off in your head. That would be a 911 emergency phone call, if you could, in fact, even make it to your phone. Yeah, once it's burst, it's like, oof. The dilation doesn't usually cause that much symptoms unless it's pressing on a part of your brain and then giving you a symptom. Yeah, the thunderclap headache, the boom type of headache, that's the rupture. It's just a sudden onset, severe headache. You should look up what the success rate is for healing on a burst aneurysm. Thunderclap. Boom. Literally, something's burst inside your head.
The survival rate for those with a ruptured brain aneurysm is about 60%. 40% die.
Yeah. So, that's a pretty bad one. The famous movie actress that dealt with it is Emilia Clarke, right? So as she was playing Khaleesi, she was dealing with that. It's pretty scary, pretty terrifying. Some self-help things for headaches. Again, blood pressure checks. Make sure you're not too stressed. It's important to be balanced in life. For migraines, go in a dark room, turn off all the lights, turn off all the noises, just kind of lowering the sensations and the input into the brain can help the brain heal with a migraine. Consulting with a medical provider. There are pressure points on the forehead here that you can press. Sinus headache, vibration and vibrating the sinuses help. I feel like that's like a whole other video on how to treat. So hopefully this video was informative and helping you guys navigate the realm of the ever mystifying headache. I remember when I graduated from school, not even having a clear picture what the different types of headaches were. Really dissecting them and putting them into little boxes helps. Like whether the pain is in the front of the head, the back of the head, one side, two sides, all over, behind the eye. Yeah, I didn't even go over ocular migraines. There's subdivisions of the subdivisions. Yeah, there's even further categories in those categories. You can go deeper and deeper, but identifying it and knowing which type of headache you have can help you find the root cause and thus the best treatment for it. If you have any further questions, feel free to leave them down in the comment section below. Until next time, everyone, take care. Number 3 type of headache, the cervicogenic.
That'll give you a headache.
Ow. Impact injury headache.